I was so excited to hear from a patient of mine last week that there is a TV show about wide-awake surgery. I don't know if you've heard about it, but TLC has a series called Awake Surgery. And this series features a plastic surgeon in Sarasota, Florida, who offers procedures to patients who are afraid of general anesthesia. Now, this is an interesting subject to me because I perform a lot of wide-awake surgery as well and have developed something of a reputation for it. And so I took great interest in watching one or two episodes of this show, and I have to kind of weigh in on the topic. So if you want to hear the good, the bad, and the ugly about this new TV series and the topic of wide-awake surgery as a whole, stay tuned. Hi everybody, I'm Dr. Jonathan Zelken. I'm a board-certified plastic surgeon in Newport Beach, California, specialist in plastic surgery and also to a smaller extent in wide-awake surgery. This is something that I've done for quite some time, and people are very interested in wide-awake facelifts and even BBLs, and so we've offered a small discussion on this series over the past 5 or 6 years on our YouTube channel. You can see these videos on my YouTube channel. I think we feature a facelift, a lot of eyelid surgery, facial sculpting, even BBL, as well as breast lifts and other procedures wide awake for patients who are afraid or just do not want to have general anesthesia. So let's talk about the good. The good about wide awake surgery is that it's just that. I mean, you are present during the operation and you are not, going to encounter surprises or anything like that. The recovery is usually less because you don't have to deal with the post-general anesthesia sort of grogginess that you'd get. And also it's probably a lot more reassuring to some patients that they are not going to lose control per se. The bad about the operation is that because you're awake and present, sometimes if you feel pain, it can sort of generate this vicious circle of pain begetting anxiety, begetting more pain, and it's hard to correct that. And so if you really are afraid of the possibility of discomfort and things like that, it may not be for everybody, despite our best efforts to numb and even sedate with some gentle oral sedation. The other thing about it is it's not always the most sterile of operations because patients are moving around and sometimes can forget that the blue sterile field is a no-go zone and you can't touch it. So people who are moving around and freely able to bend their arms and things like that, who may want to stretch, for example, or scratch their nose, could theoretically compromise the field. The ugly of the procedure is it's really not safe for everybody, and it's really not the best operation, for example, when you're dealing with implants because of the sterility issue, also because of comfort issues. With a facelift, if you've got a lot of neck work that we plan on doing, sometimes you may tolerate the procedure well, but if you were, for example, to see bleeding or something like that in the neck, the surgeon really has to focus on controlling the situation, and I'm not convinced that in all cases aggressive neck work is the safest under awake circumstances. So this is going to segue into my perception and my reaction to the first few episodes. The show features a surgeon named Meegan Gruber, and I gotta say she's very likable and she's professional, and it's kind of reassuring in this day and age to see a surgeon who is featured in mainstream media who's not a caricature of themselves, who's not goofy. She seems professional, she seems focused, and she seems passionate about the science and art of what she does, and that's kind of intoxicating to another surgeon who's watching this. It's inspiring that people who are great at their craft can sort of revel in it. But I have some issues. I think in the show, the first episode is dealing with a gentleman who has gynecomastia, and in the show I was wincing a few times during the episode because I was worried about the sterile field. You can't truly sterilize the hands and everything like that, and when the patient's that interactive and not wearing a mask, for example, and looking down at the field, moving around, even getting up off the bed, I think the breach of sterility is a lot more likely in that situation, and so it's not super ideal in my opinion to feature that. And in addition, a lot of the patients will bring in family members, and family members are truly lay people for in the vast majority of cases. Most of my patients and their families are not in the healthcare industry. So to be in the OR and sort of naive to what goes on in the OR and not having seen surgery before puts the other family member at risk of breaching that sort of, I guess, bond between patient and provider, but also fainting and losing control or saying something or just seeing things that perhaps they don't want to or should not see. I think having family members in the OR should be reserved to maybe young children who need that reassurance, and that's it. It was a little bit uncomfortable for me to watch the family's reactions to their loved ones having surgery. That's a personal thing. One thing I didn't like, though, was drinking soda pop or handling a cell phone while you're having surgery. I think of cell phones as like sneakers. They're really dirty and they can fall and things like that. I think the cell phone really has no place on the operative table. And so again, when it comes down to this show in particular, I feel that sterility was put in maybe in the back seat for the sake of having a patient experience a pleasant experience during surgery. Last but not least, I think getting up off the table to evaluate the results is really risky. I think patients who are having surgery are definitely prone to what we call vasovagal episodes. Even when I'm numbing somebody, just the act of sticking a needle into skin can make people feel queasy or pass out. If you're gonna pass out, I mean, it's really, and you have open wounds on your body, it's really kind of a scary thing. Again, from not only a life and limb standpoint, but also from a sterility standpoint. So while it seems advantageous to be able to get up and look at yourself in the mirror and to reassess, I think there's other ways of doing that. For example, maybe sitting the patient up in bed and not necessarily encouraging them to look at themselves. Again, these are personal opinions, and I'm sure Dr. Gruber does very well for herself, and I don't want to say that she's doing anything wrong. It's just not my style. But I think it's also really important for the community at large to understand that this is not how all wide-awake surgery goes. Wide-awake surgery can be performed in a way that still keeps patients out of it, in the sense that even though they're awake and hearing everything and talking, they don't necessarily need to be a part of the operation, and their family doesn't need to be either. So I like the idea of popularizing wide-awake surgery, and I think there's a lot of pros to it. I think you do so much, you'd be surprised what you can do with wide-awake surgery. Unlike what the show would present, it's not that much of a specialty. It's not that nobody does it. We all can do it. But we choose not to do it for health purposes, sterility purposes, and other reasons, including patient factors. A lot of patients do not want to have anything to do with the surgery, and they want to just close their eyes and wake up and be done with it. So I love that this show is getting popularity. I celebrate Dr. Gruber. I think she's she seems like a wonderful person. I don't know her personally. And I hope that you guys take the opportunity to watch the show. But I also want to encourage a lot of you who are considering wide-awake surgery that it doesn't have to be that intimate. You don't have to be that intimately involved unless you want to. And I would also let you know that in my operating theater, I don't really allow friends or family to join, and things are done in a little bit more of a sterile environment. So those are my thoughts. If you guys have any questions, comments, or you want to weigh in on this subject yourself, please do so in the comments below. Be sure to subscribe and turn your notifications on. Thank you so much. Bye-bye.